Hello, everyone. We are Team FAVR, and we chose the topic of improving patient wait times in primary care facilities through patient satisfaction surveys for our project. Our group members are Rachel, myself, Valerie, Florence, and Angeline. Thank you for your time. The issue brought up through our research on patient satisfaction surveys is long wait times. When a patient goes into their primary care facility, they are hoping not to have to wait for extra periods of time. They're hoping to just get in and out and get their appointment dealt with. Through research and personal experience, we've come up with numerous areas that need improvement during visits in these facilities. Almost everyone has experienced wait times during either point of check-in, when either you're waiting in line behind a few people, the reception desk hasn't noticed you for a certain amount of time. You can also experience wait time when you are actually in the exam room waiting for the doctor to come and check on you and do your appointment. Another time that patients experience wait times is when they are waiting for lab results or their diagnosis. Almost everyone who visits a primary care facility can also experience the sense of being ignored or forgotten about when a doctor or another staff member has not come up and told you why you are waiting or what the delay is, or even the estimated time that you will be waiting any longer. Through our surveys, we have come up with 2 different solutions that could address these problems.
We will complete a root cause analysis to get to the core of what's contributing to the wait times in our clinics. Surveys regarding wait times were distributed to clinical staff, non-clinical staff, and patients. The goal of our survey is to achieve superior satisfaction ratings and ensure that the facility is honoring the goals of the 6 aims. After researching some surveys online, we came up with our own questionnaire. We made sure that the questions were open-ended so that the patients, the non-clinical staff, and the clinical staff had questions that weren't for them to answer yes or no, or satisfactory or unsatisfactory, whereby they had enough to say. The first patient survey question was, did you have an appointment? How long did it take for you to be acknowledged at the reception desk? How long did you have to wait in the check-in line? Were you informed of any delays in the doctor's schedule? And the other one was, how long did you have to wait before you were called back into the examination room? How long did you have to wait in the examination room before you saw a doctor? How did the staff members communicate to you and inform you of the expected wait time? How satisfied were you with the amount of time that the doctor spent with you? Did you feel rushed at any point during this visit? Overall, how satisfied were you with this visit? After coming up with the questionnaire for this survey for the project, we've decided to we are going to give feedback based off of one of our team members' experiences at her healthcare facility. She waited for about 3 minutes before being acknowledged by the check-in desk. She also had to wait for about 5 minutes in the check-in line. She also waited for about 5 minutes before being sent to the examination room. And while in the examination room, she waited for 10 minutes before the doctor came in. She received no communication whatsoever or updates from the clinical staff.
Hello, my name is Angeline Rusu, and I will be explaining the staff survey questions, survey results from clinical staff, survey results from non-clinical staff, and explanation of surveys. So starting with staff survey questions, these are the questions that will be geared towards our staff. And number 1 is, how can patient waiting times be improved during their visit? Do you personally keep patients in the loop when their visit is getting delayed? Why or why not? Number 3, would hiring more staff decrease the patient's wait time? Why or why not? And number 4, would extending office hours decrease the patient's wait time? Weekend hours, longer clinic days, why or why not? And then lastly, number 5, do you have any other suggestions or contributions? Survey results from clinical staff. So in asking our staff the survey questions from the previous slide, the following results are shown. Delays in obtaining previously ordered lab work or test results. Patients are waiting a while for their labs to be released after getting them drawn and or for exams ordered to be read. Not enough time scheduled for patient's illness or injury. The schedule feels tight and there's not enough time allotted for seeing patients, especially very sick ones with complications. So the human factor is missing, where the expectation is that each patient will take the same amount of time, where that is not the case. Not enough staff is scheduled. The need for patients being seen and assessed is greater than the amount of staff available. Staff feel that they are trying to do more with less personnel, and so the ratio of patients to staff is greater. Too many patients are scheduled per hour. The reasoning is the same as not enough staff scheduled. So the schedule is rigid and tight and at times seems impossible because you're asked to see more patients per hour than able, especially ones with more complicated cases. And in scheduling unnecessary appointments, staff feel that instead of making an appointment to go over normal lab results and exams, they should be given that information through telephone calls with the doctor. It's unnecessary to have an appointment to go over normal results when they can be told over the phone. Survey results from non-clinical staff. The results from our non-clinical staff are the following. On-call physician schedules must be rearranged due to on-call case. Patient having difficulty completing new patient forms. Problems verifying patient's insurance, computer scheduling issues, and not enough time available in physician's schedule. So on-call physician's response time can increase patient wait times. Rearranging physician's schedule so that they are more quickly notified and available for any on-call cases would decrease patient wait times. For patients having difficulty completing the new patient forms, forms can be confusing and difficult for some new patients to fill out, and this can create more time wasted. Problems verifying patients' insurance, time is spent on issues regarding verification of patients' insurance. Computer scheduling issue, time is also wasted on issues with programs on computers that schedule patients. And lastly, there's not enough time available in physician schedules for each patient. The ratio from patient to physician is too great, and that creates more wait time for the patient. Explanation of surveys. Our surveys are based on some of the 6 aims: safe, patient-centered, timely, and efficient. The first focus, safe, is all care of patients should first and foremost be safe. So in waiting times for our patients, questions such as, is it safe for them to wait a while to be seen by the doctor or get their lab or exam results? Patient-centered means patient-centered care revolves around the patient. So in respecting our patient, they should have a sense of control. In requiring a patient to check in on time and having them wait to be seen with no communication on wait times is not really respecting the patient. Timely is pretty straightforward. It means no waits or delays. Time or wait times is what our surveys really are all about. How can we better improve wait times for our patients? Efficient is removing waste and becoming more cost effective. Wait times are wasteful for the patient. That's why we want to decrease or remove them. It also becomes more cost effective when we have our patients wait less so that we are not backed up with appointments and staff won't need to stay longer to see them. These questions targeted 3 different groups: patients, clinical staff, and non-clinical staff, and asked questions in these 4 specific areas to overall understand how patients are being treated and feeling, as well as obtaining perspectives from the clinical and non-clinical staff. Our goal is to receive insight on how we can better improve patient times so we can better improve our patients' well-being.
Hi everyone. My name is Valerie Stout, and as my teammates have explained, Team FAVR's goal was to find solutions to decrease the amount of our patients' wasted time, or MUTA. After analyzing the results of the patient surveys, the clinical staff surveys, and the non-clinical staff surveys, we decided upon two solutions. Rachel will present you with the first solution, and I will present the second one. Thank you.
The first solution that Team FAVR has come up with to address patient wait times when visiting their primary care facility is to hire more staff members. Hiring physician's assistants or nurse practitioners would help reduce wait times by giving doctors more free space and more free time when doing things such as routine visits, immunizations, strep tests, stitch removal, etc. Hiring additional staff members would also ensure that patients are getting updated throughout their appointments on reasoning for delays, reasoning the doctor's running behind, things like that. Another way we could reduce wait times is by hiring more receptionists to answer the phone calls and shorten the time that patients are standing in line to be checked in. We could also hire more staff members to do things such as cleaning rooms and other daily tasks that may be getting backed up when the facility is short-staffed. All in all, we believe that hiring more staff members would definitely lessen the wait times for patients when they are visiting the facility.
Our second solution would utilize advances with technology. In an effort to remain HIPAA compliant and with requirements in HIPAA addressing electronic communication with patients, we thought that providing a check-in kiosk or the option of mobile check-in might be a valuable option, making better use of the patient's time. By using a preferred communication method, whether it was email or the patient's cell phone, the patient could easily use that information to check in, or whatever was set up as a good identification marker. Upon checking in at the kiosk, the patient could either be instructed to have a seat, or they could be notified to complete paperwork at the reception desk, or they may even be notified that someone would be contacting them shortly or calling them shortly or coming out. Whatever needed to be indicated on the display screen. But at least that would keep the patient abreast of what was going on. If the patient wanted to talk to someone in the billing department, or if they just had a quick question for a nurse, or maybe they wanted a refill on the prescription, those could be options that the patient could select on the kiosk via the display, so that somebody from the appropriate department would be able to come down and help them with whatever they needed without them having to wait in line and say the same thing to multiple people. Another option that we thought about was the ability for a patient to check in either using a mobile app or using their cell phone. I had never really considered that before until I had an appointment with my ophthalmologist. This was an office I had not used before, but when I placed my order for my glasses, they told me that they could send me a text and let me know when they came in, and sure enough, they did just that. Got a text letting me know that my glasses had arrived and let me know the hours of that I could pick them up. And I went ahead and sent them a follow-up text, letting them know that I got the message, thanking them. And shortly after that, I received an email which indicated that they were confirming that I was coming on whatever date I had indicated to them that I would be coming to pick up my glasses. And I really thought that that was efficient and professional in the modern times. So I think that that is also a viable option. Although if we go that route, Certainly a little bit more investigation will need to be done to see what kind of finances are involved with implementing something like that. But I think that those are definitely two valid options that could be utilized, because I was certainly impressed with my ophthalmologist's office. In conclusion, although this is the healthcare industry, we are still providing a service. It is important that our patients know that we value not only them as a person, but also their time. In using the PDCA cycle as a guideline, we plan to survey the patients and staff again in 6 months to see what effect, if any, our proposed solutions have had. If the results have improved, we will perform another root analysis a year from the date of the original analysis. If the results have not improved, then we will brainstorm other solutions and try this again. Thank you for listening to Team FAVR's presentation. We hope you have enjoyed it.